I'm not just saying this because it's an Agora Pulse podcast, but I honestly don't know how we would have managed without it.
Welcome to Confessions of a Social Media Manager with me, Erin from Agora Pulse. Today I have with me Marisa Ryan. Marisa is a social media manager for Health Service Executive in Ireland, HSE. Now, if anyone's been paying attention for the past 2 years, public health services across the world have been relying on social media more and more to communicate health concerns to the people who use their service. They not only have to engage the public, listen to their concerns, but at a time when disinformation and mistrust is rife online, they have to make sure that the information they put out there is accurate, often in rapidly changing circumstances. It's not about pushing the latest hip happening product or thinking about the MQL funnel. In this sector, you're acutely dealing with people's lives. It takes a social media manager made of strong stuff to manage that day in, day out, which is where Marisa comes in. She's worked with HSE for 12 years, starting off in their communications team. She then progressed within the team, becoming their digital and social media executive in 2015, then their press officer, and then delving back into social media and digital analytics. In January 2019, she became HSE's social media manager and manages a social media team of 7, soon to be expanding. They plan and organise content across their Twitter, Instagram, Facebook, LinkedIn. I'm sure that's pretty much all of them. Maybe she'll correct me if there's more. With a combined follower rate of over 500,000. Trying to balance the priorities of a very large organisation is key to this team's work. And when asked to describe her career so far, Marisa says fun, tiring, and rewarding. Welcome, Marisa.
Thank you.
How are you doing today? Out of 10.
Oh, out of 10, today 7?
Oh,
Not
7's
bad
good.
today.
I ask out of 10 because people just say like, oh, I'm fine. But like, I think, we're social media managers and we're data driven. So I feel like we should at least try and put a number on it.
If it's an Irish thing, I'd usually say grand is the answer to everything. And grand could be anything. It could be grand or grand.
It's a sliding scale, but at least I'm hoping that by the end of this podcast, we can get you to like a 7.5.
Aw, let's say. Yes, indeed.
Can you tell me just more about your role as a social media manager at HSE?
Yeah, so I suppose you give a little introduction, and actually we have a following of 1.3 million. So I need to get that figure a little bit right, and we've worked hard to get that over the last couple of years. Well, I think the pandemic helped a little bit. We post on all the channels that you mentioned across various platforms, as you also mentioned, but we also have the public health campaigns social media channels as well. So like if people want to help to quit smoking, or they want more detail about dementia, or if they're new parents, we have a My Child social media channel. So we have lots of different varying channels. And the main ones that you mentioned, the more than 500,000, would be the HSC's main channels, which is HSC, Twitter, Facebook, LinkedIn, all of those. And I suppose we spend the time planning our content to go across those. We might work on various projects around communications. Social media wouldn't always be the first thing that happens, but we'd started, work on a project from early stages and see how we can promote the work that's been done on the website. Or we would have, over the last number of years, not leaving aside COVID and vaccines over the last 2 years, we would have had crises that we would have had to deal with through social media for various things. And there's a lot of stuff, like sometimes you might be aware of a crisis that's coming, or a negative story it's online, so you'd be planning towards that. Or sometimes it can hit you like a stream train that could happen overnight or whatever like that. So there's a lot of different things that we do. We sit in the digital team of communication, so as part of that there's a content team, UX team, digital marketing team as well. They report into me as well, so we work quite closely with them to see how we're performing. So our main aim in social is to drive traffic to our website, because it is trusted information, trusted healthcare information. So like, we're not selling a product, and we want people to go to reputable information or trusted healthcare information on our site. So I suppose that's our main aim, really.
I'm going to be asking you much more of it as we go through our questions, because I know that just what I've been admiring, really, the way that public health services have been utilizing their social media in the past 2 years, and money's not even just to the main channels, but adapting to new channels like TikTok and campaigns through that kind of thing to make sure they're reaching as many people as possible. And I suppose, I mean, I've been talking to social media managers in loads of different sectors in this podcast, and I suppose some of the defining features is like, the pandemic changed um, every way in which they communicated with all their types of customers. And I think what's been coming up the most is that crisis comms became a daily thing. And obviously, as a public health service, crisis comms is something that is baked in. I mean, the public sector sits on crisis comms probably better than the private sector. They end up getting consulting them to do that kind of stuff. So I'll be asking you about that as well, because just to get an insight into how crisis comms has had to merge with social media in a way that it hadn't been able to before, which would be really interesting. So, if someone had asked you about starting a career in social media, what would be the first piece of advice you'd give them?
I suppose you'd always be prepared for anything, like something that you wouldn't think would go viral could very easily go viral, or something that you think would work really, really well doesn't always work really, really well. And, you have to kind of always be prepared for whatever. And I know you can't really plan out a day. Like, certain amount of our days can be planned out, but not every day can. Every day is slightly different, and you might be. But it's really, really, really interesting, and fast paced is another thing that's, like, things change all the time. Something that might have worked previously on social might not necessarily work next time on social, and it's kind of like a minefield a lot of the time, that trying to keep up with everything, or analysing data that we do all the time, and see what works, what doesn't. But I would definitely, definitely encourage it. Like, there's no sign of me changing. I love what I do. Much and all as it's a busy little job, but I wouldn't change it for the world.
So, underneath everything you're saying, it's like that adaptability, isn't it? Like, you have to be as adaptable as you can. And people do say this, but like, how do you build that adaptability in social? Because like some people will realize, okay, maybe I don't quite have the resilience for this, or maybe I do. What are the things that people can realize? No, I can actually. These are things needed to be adaptable in this job.
But I suppose, like, I'm working in the health service for so long, like, I know that so much good work happens in the health service every single day, and I want social to be part of telling everybody about that story. So I suppose I'm willing to do whatever to make the health service look like that it gets the credit that it deserves. But obviously there's other sides of it as well. It doesn't always get the credit, and there is a bit of negativity around it. But I like what I do. I can see the value of social media getting to people almost cheaply. That it's not as expensive as some other advertising mechanisms, and it is we drive good quality traffic to a website. Like, we don't just throw money at something and hope for the best. Like, the quality of traffic that we're getting is really, really good. So I suppose that for the last number of years, things have been fast moving and stuff. Like, thankfully, the team that I have been here for a while, so we all seem to be interested in the fast moving or the changing, and willing to make a difference and willing to do all of that. So I suppose it's kind of, we're lucky that we are, and we have a team of agile people that are willing to make a difference.
So adaptability with like a healthy dose of passion for the job.
Yeah, a little bit.
Can you describe a typical day for you then as a social media manager?
Yeah, so I suppose the week would be, I'd have a lot of projects that I'm working on and different things, but we'd also have lots of, check-ins with the team, and that, so we'd have team check-ins a few times a week, and then the team that report directly to me, we'd have one-to-ones with them as well, so that they all get there, that they can go through different things that, they might have blockers in the way, or there might be problems or issues and some things like that. So we discuss their week, planned out their week, because we have a huge workload. Like, I couldn't keep track of everything, and I cannot say enough about my team. They keep the ship going. Like, I would have done an awful lot of COVID and the vaccine stuff over the last 2 years, but they kept everything else ticking along and going like that. And I'll try and assist them whatever way I can. So we'd have a lot of that. Then we'd have like management meetings for the entire communications team or the digital team that working on bigger projects, or some things that are coming down the line. And then you'll always have things that were never planned. Or can you just send a tweet, or can you just do this on social? With always that side of things that will come unexpectedly, and you have to decide whether it's worth fighting back to saying no, you're too late, or is it worth getting the piece of content out because it'll be beneficial to the public. So there's a lot of weighing up and deciding what's right and what's wrong. But like, we do have typical days, but then we have very, very not so typical days that you have a whole to-do list planned out and nothing gets done because a helicopter piece of work arrived in and that was it. That's throwing you aside all of a sudden.
Is that where you phrase it, as something that's come drop down from nowhere? Is that the helicopter thing?
Helicopter, yeah, the piece of work.
Health sector comms. What underpins it? I gave like a brief intro of what I believe it does, like as an observer. What do you believe it is? Like, what underpins health sector service comms?
God, I suppose just it's so important that people get, I suppose years and years ago, people were going to Dr. Google for things and that, but you could never trust what was said online because you can't self-diagnose. But because of the way the digital team work at the minute, every piece of content that goes on the website is subject matter expert checked. Like, so they might have a doctor or a clinician working with the content team to get that information over onto the site. So, and we would have seen that during COVID and vaccines a lot. The amount of traffic we got to our website during that time, especially COVID at the very beginning, because people were eating up the information. So imagine if that information wasn't correct, like it was almost damaging to people's health. So we have to ensure that that information is right, and we have to signpost to the right information then from social media. And we with COVID as well, and I'll probably keep referring back to COVID, but with COVID, it's like we had to get people to change behaviours. There was a massive piece of behaviour change going on there because we were asking people to do things that they have never done before, like, say, for example, face masks or face coverings, which it isn't something that's done in Ireland yet or whatever. And same with, I know people wash their hands, but to be consistently washing their hands for a number of times, there was a big piece of behaviour change. And I think social media really, really helped that over the last couple of years. Like, we could get our information to way more people quickly.
So you would say like there's the sort of within comms is getting a workflow in place to make sure the information that you get, usually like that you're putting out, is regulated, fact checked, all that kind of stuff. That's probably like the overall arching thing to humdrum stuff that you're doing. But then 2020 came in and suddenly you had to do behavioral change stuff in a way that was so much bigger than you had ever done in all of your careers, I imagine, like nothing that you'd even saw. So it was such a gear shift, not into like crisis comms, but behavior changing that takes a while to get in and messaging to get right. How did you feel like is there like a 2019 version of Marisa and a 2020 version of Marisa like in this job? Because I feel like there may have been.
Well, it probably, like, I feel like I've learned so much in the last 2 years, but I also feel we had crisis beforehand, and it's almost we built up to the crisis. So I remember the first one that we had to deal with in almost a social media age was a one-day storm where we had to get messages to the public about our health services. Then the next one was like a longer storm. It was a snowstorm that lasted like 4 or 5 days. That was kind of like, okay, the baby storm, then the bigger storm. And then we had a breaking news story that was pretty crisisy a few years ago, and like it was a massive media attention. Like, it was on the front page of the papers for it was a number of weeks, and we were dealing with that on social. Like, we were responding to people. So I think that we had these mini crises in comparison. So we almost had our plan. So like different things, like when we knew COVID was coming and it was the only people were interested, we knew that all the other activity could be paused. Like, there was no point in talking about diabetes because the only thing people wanted to talk about was COVID at the beginning. So little things that we would have learned from the previous things just happened. And there was a thing that we weren't expecting to do was the amount of queries that we got through social. Like, we had a small bit of community management. We'd get like if we got 10 queries a week, it would probably be a busy week. And all of a sudden, we were dealing with 1,000 queries a day. And we had to change that. Like some of our team had to just completely just sit on Agorapulse all day long, responding to queries as they went along. And that thing we wouldn't have seen. And now we are a 7 day a week service. Because we had so many queries, we had to staff it at the weekend. And we wouldn't have seen that coming. We would have thought, yeah, we'd have skeleton staff at the weekend, or we'd have people checking in and out at the weekend. But now we have our hours are from 7 o'clock in the morning to 10 o'clock at night. People are responding to queries as they come through to our social channels. You know, if somebody said that to me, I don't think I would have believed it, but it is it. And like credit is due to all the staff. Like they just took on whatever needed to be done, and we just did it. And we work closely with our, obviously the content team, and we work very closely with our campaigns team. So if there was something, they would have done research as to what people would have seen. We would have known what people were asking through our direct messages on social. So we knew what information people wanted. So we were then able to create content on social and push it out through our channels. We knew what we basically were listening. Our audience was our focus group that we were constantly checking in with because they were constantly sending questions. It's kind of a different approach.
I think what I'm picking up is that community management became such a huge thing for you, and we're seeing obviously more and more like community management has been taken. Well, the community management on the end of building communities around brands and products. I think a B2C sort of area are clocking on that they need these communities to push these things for them, but the way that the health service and public sector bodies end up approaching community, they need them, they do need community managers, but it's a sort of different angle really, because it's you're not bringing people together in a space, they are coming to you and they're coming with these questions, very detailed, and sometimes even within community management, like one of the skills you really do need is empathy, because you're getting a lot of personal stories coming in and out of those messages every day, and it's quite hard to do. So like I'm not surprised that your team had to scale up in the way that it did to respond to like the level of just abject suffering that was happening so acutely, especially within the first year of like the pandemic. And so the way that you've been doing this is obviously, social media management tools are very, very important to all social media managers. You've mentioned Agorapulse. This is a podcast presented by Agorapulse. Can I ask, when did you start your journey with Agorapulse, managing it for your socials?
I can't remember the number of years ago. I'd say it was probably about 2019. We got it. We would have been doing a HPV campaign, and in Ireland, there was kind of an anti-HPV campaign running alongside us, and anti-vax comments used to take over our campaign a little bit, and we got Agorapulse as a way to kind of track and monitor and remove if necessary, depending on our commission management policy. So we checked a few, and we got Agorapulse at the time. And I'm not just saying this because it's an Agorapulse podcast, but I honestly don't know how we would have managed without it, because we hired additional people to cover the queries in the last year. And at some points in the day, there could be 3 or 4 people responding to queries at the same time. So, Agorapulse is a way that they could see who's working on a query, who has replied previously. It's just, no, I haven't used a whole lot of other tools, but I honestly don't know how we would have managed it. And then as part of the whole pandemic, we had to report daily on impressions and queries and all of that. And, just easy pull that data from Agorapulse. And I genuinely don't know how we would have, like, could you imagine us going through Twitter DM every day trying to know what's answered and what's not when there's thousands of queries? It just would have been impossible.
Well, I think it's good to hear that the tool has been so useful in like scaling in the way that you had to do. And yeah, so I think that's what in a job that's as busy as yours, and in a team that's busy as yours, you need a tool that several people can use at the same time. They could use it easily. You could pull out power reports as quickly as you need to and get everybody on the same sort of level with the tools that you use, and then being comfortable with it, especially when you're kind of in a prolonged crisis comms mode. You need things that are reliable, and I'm glad that Agorapulse was that for you as well. When it comes to like success on social media for you, what is success when you've obviously like got these behavioral change campaigns that I mean the success is they change their behaviors. Are you able to like sort of track how that's like sentimenting? Can you sort of prove it? It might be a bit hard, but where is success coming from for social media? And then also because it's such a large organization, you've got so many people competing for interest across teams. Like, get this out on social, get this out on social. I really want this. This is our campaign. Can you plan something? What is success like for them and then for you in that context?
Yeah, so I think we are improving. Well, this year we want to do a whole lot more, and what does success look like? So, because the way we're not selling anything, so we can't really say it drove so many in sales. But I would like to, like it's great to see impressions and engagement and all of that, of course, but I'd like to deep dive a little bit further. So, I'd love to do see how far we can go with stuff like, if like say for example we did a nurse recruitment campaign and 17 nurses applied for a job, which meant because they saw an ad, and which meant that we saved the health service money on agency further down the line. Or I'd love to deep dive a little bit further. So we are planning that out this year to see how we can get more from the numbers, or almost. No, I don't think the organization struggles with social media because we've proven ourselves over the last 2 years at least anyway. But it's almost like, how do we, exactly what you were saying, how do we, when everybody's coming at us with requests to post on social, that we can say to them, no, 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 that's not what we want to do. So we have to spend a bit more time doing that this year. Like last year was totally different. We had to do social for COVID, we had to do social for vaccines. We wanted everybody to see as much as we could for the last number of years, but like everyone saw the value of social. So now the whole organization will be coming going, can we have our bit on social? And there's only so many slots that you can do on Facebook every week, or only so many ads that you can hit with people all the time, because we're very conscious of it. Like, we're asking people to stop smoking, we're asking people to get a vaccine, we're asking people to do all of these things. So we have to be careful that we don't want to drown our messages out, because we're putting out so many messages, so we have to do a big piece of work on that this year.
So you proved the value of social media to your organization, but it's also like you're going to have to go sort of one step further where you can sort of prove not prove the value in just extra results away from campaigns, like saying what we were hitting on before, like cost cutting, like proving that this is something that you can actually do for them, and in a way that's effective. Um, I hadn't quite matched up social media teams with cost cutting or like approving that, but that's good that you've got that in mind, and that's where you're going to add that sort of extra thing of like, yeah, we got impressions and a bunch of likes.
But it kind of always makes a difference. I mentioned quit smoking. If we, you can almost see, if we get a certain amount of people who quit smoking, that it would ultimately save the health service. Because if they continue, now I'm not saying that they necessarily come from smoking, from social, but if you, like, the people who smoke cost the health service so much money further down. So if we're getting people to reduce the smoking, we're saving them. So there's all of that side of things. But
Yeah, I suppose in an ideal world, you could do that sort of touch point journey saying, Mike, he saw this ad and I did the copy for this ad and he stopped smoking because of me.
and I save the health service, that kind of thing. Yeah, yeah, yeah.
Oh gosh. I mean, maybe one day with like more AI, you can like we can maybe prove this for you, but I don't think we're quite there yet, but I'm hoping hashtag one day. So the job is busy. We've established that. How do you balance, that work-life balance? Because it's such a huge feature of social media managers' lives. I feel it too. This week I've been working a bit later than I should have. But how do you manage that in the job? You've got a huge team behind you, which probably really helps. But you've been in this job and you've been in this organization for a very long time. What have you learned?
I'm probably a bad example because I'm not very good at switching off. I'm bad at that, actually. But like, you said, I have a good team. So I haven't taken a huge amount of leave over the last 2 years, which, like, I know that we can't really use the last 2 years. But I do like to, when I'm off, I'm off. Do you know the way? But one thing I definitely have learned is, I think I need to be abroad to really switch off, because especially with COVID and everything, you can't really get away from it. Now, I have been known to, I just saw this thing when I'm on leave, but like that's completely my own choice. It's not expected by the organization. I think that's my personality. I don't know if I'll ever change for something like that. I don't like, the way some people do digital detox. I've never done one. I don't know if I ever will. Um, I tend to, when I'm not working, that I don't look at our own channels, the organization channels. I look at my own. Like, I don't log into the other accounts to see how they're performing. I don't go there, but it's a hard one. But then in a weird way, I like to be needed as well. That if something happened, that I want to, they call me send me sorted it, but a little bit like that as well. But I also want, but then I'd never ever expect one of my team members to work when they weren't working. It's a funny one with me.
So it's like I think what I'm like learning from talking to different social media managers is like this job does promote a level of like hypervigilance and perfectionism, because we're in the most public facing job. Well, I mean, you're in your organization, there are literally like doctors, but like, but you're there listening to and seeing so many people's opinions, and like that level, especially that regulatory level that you've got in your job, everything has to be really quite right. There is not much room sort of like for mistakes. But considering that, has there ever been any mistakes you've made whilst working in social?
We have kind of processes like that as well. I don't know if it's just a digital team thing, or like we have a 2-eye process. So every piece of content that goes out from any of our channels has 2 pairs of eyes on it at all times. So I suppose we have that. So there isn't as much like, I've sometimes posted to the wrong channel, like, accidentally, or it went out, or I scheduled it a week later and wondered, where is it? I know I did it, and realized the date. But I don't know if there's anything that I've massively made a mistake on. I know that one thing that I did over the vaccine, like, I thought somebody had an idea about something, and I honestly thought it was going to be, oh yeah, sure, we'll do it once. We'll never hear it again. And sure, it was the best idea ever. And if I said no to that thing, it would have, not that, it would have been fine, but I'm still mortified that I didn't see the foresight of how useful that thing was that they suggested that we do on social. But I don't know if I've ever made a massive mistake. I don't think I'd be in the job if I did. I don't know. I can't think of anything really.
Well, I'm happy for you. I've made mistakes, but I'm not gonna actually reveal them until like the very end of the process, like the end of the series, because I've done some stupid stuff. So you mentioned your team. Um, so who makes up the team? What are the roles? How much has it expanded? Do you have plans to expand it more? And also within that, because you're like the nexus between so many different parts of the organization, and you've got the UX team, you've got the wider marketing team. How are you like meeting in the week and organizing your time together? Have you got like a huge ass Asana board? Are you meeting probably not much in person? What's that like, having your existing social media team and then all these other people that you need to sort of stakeholder manage?
So I suppose to start off, like, we have this communications planning group. So basically, if somebody in the organization needs communication support, they fill out this form and they tell us what they want, and people are assigned basically to different things. Then we have the ongoing things like, I keep mentioning quit smoking, but campaigns like that, social media for them is always on. So we work off month on month calendars. Like, there might be busy months, but there might be quieter months, but it's always been planned. So we've dedicated people looking after that. Then there's different things like COVID and vaccine would have been big things like that. So they'd have weekly meetings on that, planning out, but like that, always on social. So planning out that as you go along. We meet as a social team a few times a week, and that's a lot of that is to to make sure everybody's okay, everybody's working from home, things are quite different. And then we have a dedicated team working on Agora, so like community management, and we use Slack all the time to communicate with each other. And I suppose that's one thing. Like, I wouldn't be the best at responding to email immediately, but Slack would be pretty immediate. If somebody needed me, just pop me Slack and I can get that. Um, it's hard to pull everything together, but some things are so structured that it just kind of happens. So um, I'm social media manager. I have two teams who they look after the campaigns, so they have a certain number of campaigns each, and then we've junior team members that would do anything for you at anything. So if if they need stats or anything, they're because the queries on Agora aren't as busy at the minute, so they're willing to learn new things and willing to learn more about social. So they're kind of there to guide us in that. So basically, if we're ever stuck on something, and I mentioned that some of the team members are there for a number of years, so they almost have experience in different sort of campaigns. So, let's say, for example, if we've information on cancer, like Anya, who's on my team, would have done a few campaigns on that. So I automatically lean on her for that. Or if there's a breastfeeding campaign, Tom looks after my child, so I automatically go to Tom for that. And some of them naturally are divided out, but then others, we decide who has space or who has capacity to do a smaller campaign.
So it's not quite like, so we've got social media manager, so you don't have like, so is it like we have the content writer and then you've got a social media officer and then you've got inbound marketing, sort of inbound paid person? So it's like, are that not like the titles that you have?
Oh, we use an agency then to do all the paid side of it, and they would write the copy for the page, and then we'd approve the copy and approve the creative. It depends. Like we do an awful lot of the organic stuff ourselves, but then the page has gone to an agency, and then because of the content writers, we do it amongst ourselves. So the guys would work on various parts of it. Based on our web copy, because the web copy is already signed off by subject matter experts, so it's good to go to social. It's they've content guidelines, so we know it's good enough. We socialize it a little bit, but the information on the website is very much fact checked. So
I want to get my head around this just so I can, so like the paid and organic are cleaved. So you've got the agency to go do all the paid stuff, like those, maybe that smoking campaign, they will keep running those ads and things like that. You've got your in-house team, community managing, doing the organic stuff, doing the organic writing content, that kind of thing. And then obviously being the touch points between the rest of the organization to get those things done and get like those comms queries that come in through the forms and things like that. And then that seems to be it then, right?
yeah, so then like the agencies would send us monthly reports, and we have somebody on the team who would be, she's a lot of experience with Facebook advertising and that. So, we can kind of see ourselves what's working, what's not. We would spend a lot of time looking at the back end of Facebook or Twitter, or we know ourselves what works and what's been working in that. And that's that side of it. And not necessarily just from a paid point of view, but we had an approach during COVID where we were boosting posts on Facebook as well as doing paid advertising, but we were getting such good organic reach, there was no point in boosting the posts, that we just said put the boost money into a paid, like things like that we learned ourselves. We didn't have that from the agency. We seem to have built up skills that we probably thought we would never have a couple of years ago, but the more you're looking at it, the more you realize, okay, I think there's a new thing, let's try something else. So a lot of our information on we don't bother doing boosted content anymore on Facebook. It's paid and organic, so kind of changes. Constantly changing, I think. Is
I think it's constantly changing. So it sounds like you're in good harmony with your in-house and your agency, that there's a good push and pull between what you guys are doing, because sometimes
Yeah, we like to not keep the agency on our toes. Like the agency keep us on our toes, and we keep them on our toes. Like we want to, and as we're public as well, we this is public money that we're spending, so we have to be careful. We want to make sure that it's working, and it's getting as much as we can out of the money.
yes, because that can be sometimes when that sort of in-house and agency relationship breaks down or gets rocky. It's like it's not great, and it's not, especially when you've got public money. It's not brilliant to have that relationship go to crap. But yeah, so when it comes to like an organization, investing and taking social media seriously, what would you say to convince people when you're coming into an organization that social media is something that they really need to take notice of? Because there'll be social media managers listening to this who, maybe going from different jobs and things like that, and they're probably going into places where they need the social media manager, but the knowledge and the expertise isn't quite there for social. I imagine because you're working in such a large public sector organization, there's no time for people to understand what the latest stuff is happening on social. They're there for you. You need to do that for them. What have you learned to keep people to up to date and to advocate the value of social?
Well, I think the data speaks for itself. That's one thing I would say. We're very lucky in the HSE that a lot of our leaders and that they see the value of it and they use Twitter or whatever themselves. They see it as a good tool themselves for doing it. And the communications senior management would have been advocating it for a number of years as well. But I've often been in a room with somebody going, why? You know, I don't see what, but prove it. And the one thing about social is that you can, because of the data that you get across from it, that so many people saw this, so many people acted on this, so you just have to keep consistently building the data pile to show that it's working, and like analytics, so it goes from the social to the web analytics to where they went next to taking an action or whatever. So I suppose we've built it up over the last number of years, and we've lots of examples to prove to the organisation if we're ever asked to. And I think people do get a bit social savvy, but not to the level that we do, because they'd often say, come and say, can you tweet this? But it's not relevant to Twitter because it's a different channel, and we might try something else. I hate saying no to people, but it's for the best. We wouldn't just do something on social just because somebody thinks. Now, in saying that, the organisation might have different priorities, and sometimes we might have to do something just because there's government involved or political or something. So sometimes you can't avoid things like that, but the majority of the time they take our advice and willing to work with us. We get a lot of requests for people in the organisation looking to set up their own accounts, but
Oh, do not get me started on the little upstarts and departments who want to say,
oh, good. I thought that was just a HSE thing.
no, 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 no. It's. I think. I mean, I've experienced it within the university when I used to work at social media manager for a university, and then it does happen sometimes in other jobs that I've been, especially on the public sector side, because they're like, "Oh, we want to do it, and we've got so many things to say," and then you say to them, "Okay, so who's going to manage it every day? Have you got a content plan? Who's going to do the ads if you want to do them? Who's going to look after the channel? Oh, you can look after the channel. I did not sign up to look after your fresh baby channel." I'm ranting a little bit because it is a trigger.
No, I get it. I get it.
So, Marisa, what do you think is the future for your sector?
Well, we've been kind of doing these real exciting things for the last little while, running closed groups. I know closed groups aren't very new, but they're new enough to us. So basically, for different things like breastfeeding mothers or people with diabetes or people who want to quit smoking, we set up a closed group. They agree to go into it, and a healthcare expert goes into the group along with them. So they're able to give them solid advice, tips. We have a content calendar along with them, and they go along with them for the 8 weeks, 12 weeks, or whatever it is. So I'm kind of thinking we'll push that out. They're being evaluated at the minute just to make sure that they are working, that it's a good intervention and working alongside medical advice. So I think we'll kind of expand that a little bit over the next couple of years. And I suppose we'll just have to go with whatever changes in social happen. Things happen so quickly all the time that we have to keep on top of that. And it's hard because we worked at such speed in the last 2 years. I'd hate for us to be known in the organisation as working at that speed all the time, because it's pressure, and I don't want that pressure on us all the time. But really, really proud of the work we've done in the last 2 years and the commitment everybody has given on the team. So we'll continue with that, I hope.
Do you have any very quick advice for anyone who wants to work in public health sector comms? ways to get in, ways to understand the role that they want to do eventually?
Well, I think I benefited hugely from working in the press office previously, from working in the organisation to understand the HSE as a whole, to understand the organisation. So, like, there's kind of, I think, two streams to the social media side. Yes, of course, understanding how social media works and all of that, but it's also really important for us to understand the HSE itself, like to understand how it works a little bit. So I definitely benefited from having a little bit of background there to get where I am today. Um, like it's an incredibly rewarding section, communications, that we work in. We're all so proud of our work that we do every single day, and I just hope that continues.
Brilliant. Well, Marisa, thank you so much for joining us today. We've got some quick fire questions. Are you ready for them? Twitter or Clubhouse?
Oh, Twitter.
What was the first social media site you ever signed up to?
Bebo. Does that show my age?
If there was one social media site you could get rid of today with a snap of your fingers, which would it be?
I think for my job, I'd probably get rid of TikTok just because we find it hard to get in there. But oh, personally, oh God, Twitter maybe. It's a bit negative. Mm, yeah, no, I think I'll just get rid of TikTok.
If you could run anybody else's social media accounts, who would they be?
Um, I think possibly at the minute, Little. I think they're very humorous and quick fire, and yeah, they just have. I just think the little bit of banter between Little and Aldi or other supermarkets are quite. It's fun. I think that for them. That's who I'd go for.
What is the one social media trend that you will just never take part in?
And I don't think I can be any. I don't tend to share a whole lot. Well, I actually don't share anything on my social networks. Like, if anybody, it should be a waste of time to follow me because I don't really share much. So I'm not really, weirdly, and I absolutely adore social, but I'm not willing to share my life on it. Is that one?
I think that is one. Yeah, I think that's one. Basically, oversharing anything. You're never going to be the oversharer that is like live streaming their breakdown. Any sharing. Don't know me. Don't do not perceive Marisa, basically, is what we've learned today. Don't look at her, don't perceive her. Yeah, don't get to know her. I was going to ask where can people find you, but we won't do that because it's like, don't find Marisa. Thank you, Marisa, so much for joining us today. We've learned so much about public sector comms and doing social media for public health sector. Where can people find you?
Well, my own channels would probably be a bit redundant. Marisa Ryan on a lot of them. Or HSE, HSE Live, or HSE Ireland on the main Irish Health Service channels. Either or. We'll accept follows from both.